A peripheral vein cannula is placed for intravenous fluid therapy, drug therapy, nutrition solution, blood products, and to secure vascular access in situations requiring urgent treatment. Before starting the cannulation, it is important to gather the necessary equipment to have everything within reach. Retrieving instruments during cannulation endangers the aseptics of the procedure and patient safety. The necessary tools for peripheral cannulations are cannula, hand sanitizer, tourniquet, 70% alcohol and pads, factory clean gloves, sharp disposal container, semi-permeable protective film, connector tube, and ready-to-use saline flushing syringe, which can be used to ensure the functionality of the cannula. Before starting the procedure, the patient's identity must be confirmed. Identity is confirmed by either asking the patient their social security number or by checking the patient's ID bracelet. After that, you inform the patient the indication for the cannulation and how the procedure will go. The patient's arm is placed in the right position. A pillow can be used for support. Then the tourniquet is placed on the patient's arm tightly. This prevents the blood flow and makes the vein more visible. Then the search for the vein begins. Before starting to cannulate, the nurse disinfects the hands carefully, after which she puts on her gloves. After finding the vein, the nurse cleans the injection site with an alcohol-soaked cleaning pad with one long stroke, after which the injection site must no longer be touched. The cannula's protective cap is taken off and a firm 3-finger grip is secured. The skin area is slightly stretched so that the vein stays better in place when entering. When piercing the skin, inject at an angle of about 30 degrees. When the needle tip is in the vein and the blood flows into the chamber, the tourniquet is released and the needle is pushed into the vein. The needle inside the cannula is withdrawn away from the vein while simultaneously pushing the plastic cannula into the vein. When the needle has been withdrawn from the cannula, blood flow from the cannula is prevented by pressing the vein in front of the cannula with finger. The needle is immediately placed in the sharp disposal container. The needle-free connector is connected to the saline syringe in advance. This will then remain in the cannula. Before inserting it into the cannula, the needle-free connector is filled with saline. Then function of the cannula is checked by injecting saline solution into the cannula. The cannula is in the vein if it draws well and does not cause pain or fluid accumulation on the skin. The cannula is partially secured with a transparent adhesive tape. This allows for monitoring of the puncture area. After that, a secure cap is added.